Hello everyone, and welcome back to my channel. Thank you for joining us today. It's a pleasure to see such a great audience, and I'm excited to delve into a significant health topic that affects many people around the world: brain aneurysms. To begin with, a brain aneurysm, often referred to as a cerebral aneurysm, is a bulging, weakened area in the wall of a blood vessel in the brain. This balloon-like formation can occur in various locations within the brain and may remain small and asymptomatic for many years. However, if an aneurysm grows large enough, it can rupture, leading to a potentially life-threatening condition known as a subarachnoid hemorrhage. This can cause severe complications, including stroke, brain damage, or even death. Today, we'll explore the causes, symptoms, risks, and available treatments for brain aneurysms, and how understanding this condition can empower us to recognize signs and seek timely medical intervention. Let's get started. A brain aneurysm, also called a cerebral aneurysm, is a weak spot in the wall of a blood vessel in the brain that bulges and fills with blood. It can be dangerous if it ruptures, leading to bleeding in the brain, known as a hemorrhagic stroke. This condition is a medical emergency and can be life-threatening. Brain aneurysms can vary in size and severity, and many don't cause symptoms unless they are large or rupture. However, some possible symptoms before rupture include severe headache, blurred or double vision, neck pain or stiffness, sensitivity to light, nausea or vomiting, loss of consciousness or confusion. When an aneurysm ruptures, symptoms can include a sudden, extremely severe headache, thunderclap headache, loss of consciousness, seizures, and other neurological symptoms. Risk factors for brain aneurysms include high blood pressure, smoking, family history of aneurysms, certain genetic conditions or connective tissue disorders. Diagnosis is often made through imaging tests like a CT scan, MRI, or cerebral angiography. Treatment options include surgical clipping or endovascular coiling to prevent rupture, or emergency treatment if rupture occurs. The exact cause of brain aneurysms isn't fully understood, but they develop due to weaknesses in the walls of blood vessels in the brain. Several factors can contribute to this weakness, leading to the formation of an aneurysm. These include 1. High blood pressure, hypertension. Chronic high blood pressure puts extra strain on the blood vessels, which can weaken them over time, making aneurysms more likely to develop. 2. Smoking. Smoking damages blood vessels and is a significant risk factor for the development and rupture of aneurysms. It can weaken the vessel walls, increasing the risk of an aneurysm forming and rupturing. 3. Genetic factors. Some people may inherit a tendency to develop aneurysms due to genetic conditions. These can include disorders that affect the connective tissues of the body, such as Ehlers-Danlos syndrome, polycystic kidney disease, Marfan syndrome. A family history of aneurysms also increases the risk. 4. Age and gender. Aneurysms are more common in people over 40, and women are more likely than men to develop them. This may be related to hormonal changes that affect the structure of blood vessels. 5. Head trauma or infection. Severe head injuries can sometimes weaken blood vessels, potentially leading to aneurysms. Certain infections that affect the blood vessels can also increase the risk. 6. Atherosclerosis. This condition, where the arteries harden and narrow due to the buildup of plaque, can increase the pressure on the blood vessel walls and potentially lead to aneurysm formation. 7. Drug use. The use of certain recreational drugs, particularly cocaine or amphetamines, can lead to spikes in blood pressure, weakening blood vessels and increasing the risk of aneurysms. In many cases, however, a specific cause for an aneurysm cannot be identified, and it may develop due to a combination of genetic and environmental factors. Brain aneurysms often don't show symptoms unless they are large or have ruptured. However, if an aneurysm is pressing on nearby structures in the brain or is about to rupture, there can be warning signs. The symptoms can vary depending on whether the aneurysm is unruptured or has ruptured. Symptoms of an unruptured aneurysm. Unruptured aneurysms often cause no symptoms, but if they grow large or press on surrounding nerves or tissues, they may cause headaches, localized pain behind or above the eye, blurred or double vision, pain above or behind the eyes, dilated pupils, weakness or numbness on one side of the face, difficulty concentrating or cognitive changes. Symptoms of a ruptured aneurysm. A ruptured brain aneurysm is a medical emergency and typically presents with sudden, severe symptoms. These include sudden, severe headache, thunderclap headache, often described as the worst headache of one's life, loss of consciousness, brief or prolonged, nausea and vomiting, seizures, stiff neck, sensitivity to light, photophobia, blurred or double vision, confusion, agitation, or difficulty concentrating, drooping eyelid, weakness or numbness in the limbs, difficulty speaking or understanding speech. Symptoms of a leaking aneurysm. Before a full rupture, an aneurysm may leak a small amount of blood, causing what's called a sentinel headache, which is a warning headache that can occur days or weeks before a larger rupture. If you or someone else is experiencing these symptoms, especially a sudden severe headache, it is critical to seek emergency medical care immediately, as a ruptured aneurysm can lead to serious complications like stroke, brain damage, or death. Risks of brain aneurysms. The main risks associated with brain aneurysms depend on whether the aneurysm has ruptured or not. 1. Unruptured aneurysms. Growth or rupture. Unruptured aneurysms can grow larger over time, which increases the risk of rupture. Compression of surrounding brain tissue or nerves. Large aneurysms can press on nearby brain structures, causing symptoms such as headaches, vision problems, or nerve damage. 2. Ruptured aneurysms. Subarachnoid hemorrhage. A ruptured aneurysm leads to bleeding in the space between the brain and the surrounding tissue, called a subarachnoid hemorrhage. This can cause brain damage, stroke, or death. Vasospasm. After a rupture, blood vessels in the brain can spasm, reducing blood flow and increasing the risk of stroke. Hydrocephalus. Blood can block the flow of cerebrospinal fluid, leading to a buildup of fluid and increased pressure on the brain. Coma or death. In severe cases, rupture can result in coma or death, depending on the location and severity of the hemorrhage. Treatment options for brain aneurysms. 1. Monitoring/observation for small, unruptured aneurysms. Watchful waiting. If an aneurysm is small and not causing symptoms, doctors may recommend regular monitoring with imaging tests, like MRI or CT scans, to track its size and growth. This approach may be suggested for older individuals or those with other serious health conditions, where the risks of treatment may outweigh the benefits. 2. Surgical treatment options. A. Clipping surgery. Procedure. A neurosurgeon makes an incision in the skull, craniotomy, and places a small metal clip across the base, neck, of the aneurysm to stop blood flow into the aneurysm and prevent rupture. Risks. Clipping is a more invasive procedure and carries risks such as infection, bleeding, stroke, or damage to nearby brain tissue. Recovery can also be longer due to the open surgery. Best for large or complex aneurysms, when the aneurysm is located in a part of the brain where endovascular coiling isn't ideal. B. Endovascular coiling. Procedure, a less invasive option, where a catheter is threaded through the blood vessels, usually from the groin, to the aneurysm. Tiny platinum coils are inserted into the aneurysm to fill it, promoting blood clotting and reducing the risk of rupture. Risks. The risks include blood vessel damage, infection, or complications from anesthesia. However, it is generally less risky than open surgery. Best for many types of aneurysms, especially those located in more difficult-to-reach areas of the brain. C. Flow diverters. Procedure, a stent-like device is placed inside the artery at the aneurysm site, diverting blood flow away from the aneurysm and allowing it to heal over time. Risks, like coiling, there is a risk of complications such as bleeding or stroke, but it is a minimally invasive approach. Best for larger or wide-necked aneurysms that might not be well suited for clipping or coiling. 3. Treatment after a rupture. A. Emergency surgery. Clipping or coiling. If an aneurysm ruptures, emergency surgery, either by clipping or coiling, is required to stop the bleeding. B. Medications post-rupture. Calcium channel blockers, e.g., nimodipine. These are used to prevent vasospasm and improve blood flow after a rupture. Anticonvulsants. These may be prescribed to prevent seizures after a rupture. Pain management and sedatives, to control pain and manage agitation or anxiety following the rupture or surgery. 4. Lifestyle changes and preventive measures. Blood pressure management. High blood pressure is a significant risk factor for aneurysm growth or rupture. Medications or lifestyle changes, exercise, diet, stress management, can help reduce this risk. Smoking cessation. Smoking weakens blood vessel walls and is a significant risk factor for aneurysm formation and rupture. Quitting smoking can lower the risk. Healthy diet and exercise. Maintaining a healthy diet and engaging in regular exercise can help control risk factors like high cholesterol and high blood pressure. 5. Long-term monitoring. Even after treatment, regular follow-up imaging may be required to ensure the aneurysm doesn't grow back or that new aneurysms haven't formed. Factors influencing treatment choice. Size and location of the aneurysm. Larger or more complex aneurysms may require different treatment approaches. Patient's age and overall health. Older individuals or those with other medical conditions may be at greater risk from surgery and may opt for less invasive treatments or monitoring. Risk of rupture. Aneurysms that are likely to rupture may require more urgent and aggressive treatment. If you are concerned about treatment options for a brain aneurysm, it's important to consult a neurologist or neurosurgeon for a personalized evaluation. They can help weigh the risks and benefits of each treatment based on your specific circumstances. Medications are not typically used to treat the aneurysm itself, but they can be used to manage symptoms or reduce the risk of complications associated with brain aneurysms. If an aneurysm is found and has not ruptured, or if a person is recovering from surgery after a rupture, medications might be prescribed to manage risk factors and symptoms. Common types of medications used for brain aneurysms. 1. Medications to control blood pressure. Antihypertensives, blood pressure medications. Since high blood pressure can increase the risk of an aneurysm rupture, medications like beta blockers, ACE inhibitors, or calcium channel blockers may be prescribed to keep blood pressure under control and reduce the risk of a rupture. 2. Pain relievers. Non-opioid analgesics. If an unruptured aneurysm is causing headaches or pain, mild pain relievers such as acetaminophen may be recommended to alleviate discomfort. However, stronger pain medications might be avoided as they could obscure early warning signs of rupture. 3. Anti-seizure medications. Anticonvulsants. After a ruptured aneurysm, seizures can occur due to brain damage or irritation. Anticonvulsant medications may be used to prevent or control seizures. 4. Calcium channel blockers, to prevent vasospasm. Nimodipine. After a ruptured aneurysm, blood vessels in the brain may constrict, a condition called vasospasm, reducing blood flow and increasing the risk of brain damage. Nimodipine, a calcium channel blocker, is commonly used after a rupture to help prevent vasospasm and improve blood flow to the brain. 5. Stool softeners. Stool softeners or laxatives, to prevent straining during bowel movements, which can increase blood pressure and the risk of rupture. Stool softeners may be prescribed to minimize the strain. 6. Sedatives and anti-anxiety medications. Benzodiazepines or other sedatives. These might be prescribed in some cases to help manage extreme anxiety or agitation, especially after a rupture or surgery, as stress can elevate blood pressure. 7. Anticoagulants, blood thinners. Not typically used, anticoagulants are generally avoided if an aneurysm is present because they increase the risk of bleeding if the aneurysm ruptures. However, they might be used in cases of other cardiovascular risks, but only under careful medical supervision. Post-surgical medications. If surgery is performed, such as clipping or coiling of the aneurysm, medications are often used to manage pain, prevent infection, and support recovery. If you are concerned about your specific situation or medications you may need, it is essential to consult a healthcare provider for personalized advice. Managing stress and anxiety related to health concerns, like the fear of developing a brain aneurysm, can be challenging but is important for your overall well-being. Here are some strategies that may help you cope with these feelings. 1. Educate yourself but avoid excessive research. Learning about your condition or risk can empower you, but try to avoid excessive searching or dwelling on worst-case scenarios, which can fuel anxiety. Focus on factual information from trusted medical sources. 2. Regular physical activity. Exercise is a natural stress reliever. Even moderate activities like walking, swimming, or yoga can help lower stress levels and improve mood. Cardiovascular exercises can also help manage blood pressure, which is a key factor in brain aneurysm risk. 3. Mindfulness and meditation. Mindfulness techniques, like deep breathing exercises, meditation, and grounding exercises, can help calm your mind. Apps like Headspace or Calm offer guided sessions that are great for managing stress and anxiety. 4. Limit caffeine and stimulants. Reducing caffeine intake can help minimize feelings of nervousness or restlessness, which can amplify anxiety. 5. Cognitive behavioral therapy (CBT). CBT can be effective for managing health anxiety. It helps you challenge and reframe negative thoughts and can be a useful tool if you find your worry becoming overwhelming. 6. Connect with others. Talking to friends, family, or a therapist about your worries can provide emotional support and perspective. Support groups or forums can also help you feel less alone in your experience. 7. Focus on what you can control. While you can't control every health risk, you can focus on lifestyle changes that reduce your overall risk, such as maintaining a healthy diet, managing blood pressure, and avoiding smoking. 8. Establish a relaxation routine. Incorporating activities that relax you, whether that's reading, listening to music, or practicing hobbies, into your daily routine can help reduce overall stress levels. 9. Talk to your doctor. If you're worried about your risk of a brain aneurysm, discussing your concerns with a healthcare professional can be reassuring. They may suggest preventive measures, monitor your health, or recommend further evaluation if necessary. 10. Set boundaries with your thoughts. Sometimes, it helps to set aside a specific, worry time, during the day where you allow yourself to think about your concerns for a limited time. After that, gently redirect your thoughts when they pop up outside of this window. If you or someone you know has experienced a brain aneurysm, we invite you to share your stories in the comments below. Your experiences can provide support and encouragement to others who may be going through a similar journey. Don't forget to like this video, share it with others who might benefit, and subscribe to our channel for more informative content. Together, we can raise awareness and create a supportive community.